Then it's my great pleasure to welcome Collette. Thank you for being with us, Collette, and a really timely time, yes, a timely time to receive this presentation. It's something we're all talking about, and it will be really good to have this context. So thank you so much for being with us. It's a very full presentation, and having had a read through, fascinating. So look forward to hearing from you.
Well, thank you. So we're going to play this game that Karen is going to try and run the slide deck. And we'll try and keep up with each other, Karen, but it's not rehearsed, so we'll just have to do our best. So my name is Collette Le Van Gilroy, and I work for Public Health in the Surrey County Council. And ordinarily, I do this presentation with people with lived experience and third sector organisations from Surrey and health colleagues, but today there's a massive big Changing Futures national event, so they're all there, and I said I'd try and pull in this one off myself, so here's hoping. Thanks, Karen. So the whole premise is reducing health inequalities and improving outcomes for people with multiple disadvantage in Surrey. Next slide. So just a bit about the background and how we are where we are today. So within Public Health in Surrey, I work within the Health and Wellbeing Programme team. So there are 5 main teams within the Surrey Public Health Directorate. I work inside the Health and Wellbeing Programme team, and there are 5 permanent full-time members of staff that are on this programme to reduce health inequalities and tackle multiple disadvantage. And in addition to that, our third sector organisations, we have 10 at our sites, 12 practically full-time lived experienced experts with us, and a whole range of other people that I'll mention as we go through the presentation. Thanks, Karen. And so there are 3 main priorities within the health and wellbeing strategy of Surrey. Our teams, the health and wellbeing team, programme manage the Health and Wellbeing Board. The work that I'm about to talk to you today interlinks with priority 1 of the strategy, priority 2, which is mental health improvement plan, and priority 3, which are the wider determinants of health. And everything that we do obviously crosses all of those priorities. So there's a lot of other people and agencies that are involved with us. Thanks, Karen. So what is multiple disadvantage? Now, I say this because a lot of people actually get quite confused about what the definition actually is. So the definition to which we're working is the government definition for the Changing Futures programme. And so a person with multiple disadvantage in this context would have 3 or more of the following issues. So mental health and or behavioural issues, homelessness or risk of homelessness, substance use, misuse, contact with the criminal justice system, or domestic abuse. So it's 3 or more of those disadvantages. Next. So Surrey, well, it's a 2-tier system. I've been in Surrey for 2 years. I came from working in the centre of London, so I was used to places like Westminster, Kensington, Hammersmith and Fulham, and then over into Hackney and City. When I came to Surrey, it's a bit of a learning curve to work inside a 2-tier system, shall we say. So basically Surrey County Council is responsible for things like education, social services, transport, etc., public health. Sorry, missed that one out. And then we have our 11 districts and boroughs, and they provide the local services, things like housing support, the homelessness outreach teams in this capacity. And we all work very, very closely together. And we have 2 integrated care partnerships. So there's the Surrey Heartlands Health and Care Partnership and Frimley Health and Care. But to be honest, we all work as a huge, big family, particularly on this programme. So where people come from often doesn't really matter. It's the outcomes that we're trying to achieve. Thanks, Karen. Okay, so in order for the team to put forward a bid for a Changing Futures fund, we worked for about 4 or 5 months on mapping blockages and strengths with experts by experience, so people with lived experience, their carers, the families, homeless charities, domestic abuse, mental health, and many faith sector organisations to try and work out what was working for this cohort of people and what we needed to try and tackle collectively. And that diagram that you're looking at there is actually it's an interactive map, and we use it very regularly. We use it in meetings, particularly when we're working with all the third sector organisations to work out, are we actually removing some of the blockages? So, and that will come up again later. Thanks, Karen. Okay, so one of the things that repeatedly came out in all the consultation and engagement and feedback from everybody was that many people with multiple disadvantage had trauma in their background. And it obviously affects the way people are and the way that they receive help. And their approach to relationships can also be quite mixed. And so we decided with the third sector, with people with lived experience and families and carers, that we would put our Changing Futures bid in with an approach to try and tackle the trauma that was behind some of the issues. And it's true to say that many trauma advisors still feel unsafe and they lack trust and they live with anxiety, etc. So our whole modus operandi was to try and put services in where we could overcome some of those barriers. Thanks, Karen. So another thing that happened at the same time was this great big pandemic thing called COVID. And at that time, I was just trying to get to know how Surrey was working, right, having come down from London. And it is complex. You've got the 11 districts and boroughs all doing a fabulous job in the housing departments, etc. But there were a number of people that just did not fit into the system quickly enough. And of course, the vast majority of them had COVID. So very quickly, we set up three, in partnership, I must say, with the housing department. We set up 3 cabin sites. Each cabin site had 12 individual cabins. They're absolutely beautiful inside. They look a bit industrial outside, but inside, absolutely beautiful. You go inside, there's a little single bed. There was a desk on the other side, fridge, freezer, microwave, everything you could think of, completely self-contained, and a little loo at the back and shower area at the back. And so we created very quickly with the 11 districts and boroughs and public health led, and we created a joint referral process and an onward accommodation scheme, which sometimes had to mean that even if people didn't have a local connection in one borough, we could slip them into another borough, even if it was only temporary. So in the period of time that I had the cabins up and running, it was December 2020 to May 2022, so just this year. And we had 184 residents go through those cabins, and the vast majority of them had multiple disadvantage. So one of the big things that we did was wrap a trauma-informed care package around them. So they had 24-hour security, but we used a security company that were all ex-military, so paratroopers, army, etc., who themselves had been trained or gone through trauma. And we upskilled that workforce so that they were there 24/7 with the occupants, and also wrapped around where we could mental health services and the substance misuse teams, etc. And where people had social workers, they were popping in and out the sites. So it's quite vibrant. We are actually going to open up a 4th site. So as I said, these 3 sites, the last of the 3 sites closed in May 2022. But since then, we've had 15 cases of people that could urgently have used a cabin. So we are going to open up another site, a smaller site, but we're going to open it up from the end of October and just use the same sort of principles around it. Thanks, Karen. So with 27 partners, so the 27 partners that put in the bid for the Changing Futures Fund included all our third sector's homeless charities, mental health charities, DV partnerships, the police, probation. I'll not read them all out, but there are 27 of us all in it and put forward a bid to the Changing Futures programme. And we were awarded £2.8 million, which will take us to March 2024. And as I mentioned earlier, the whole premise of what we're trying to do is a trauma-informed approach. So we competed against 97 areas in the country, so very proud to be one of the 15 that were awarded the money. So in terms of governance, we have multi-agency groups. So Surrey already had set up a Surrey Adults Matter group, which is based on the MEME approach, and that had been set up the year before I had arrived. And they effectively do the referrals and the team around the person for people with multiple disadvantage. And you'll see later in the slide, but a year ago we had 40 people in that programme. There's now well over 100. And then we set up another group called Tackling Multiple Disadvantage. That's a multi-agency group tackling multiple disadvantage. And I was chairing it with the ICS director, Vicky Stobbart. Well, her title wasn't ICS, obviously, but it is now. Until yesterday, and yesterday probation has taken over, so I co-chaired them now with probation and public health, but prior to that it was Vicky Stobbart of CCG. And basically there's a steering group co-chaired by public health housing, and there's a delivery arm which is the Tackling Multiple Disadvantage group. And we report to the Health and Wellbeing Board quarterly in the published highlight report and 6 weekly on the delivery plan update. And then the Changing Futures National Team quarterly full progress reports on every aspect of the bid that we submitted, plus the forward delivery plans. Yeah, great. Thanks, Karen. Okay, so just phase one, I thought I'd just run through with you what happened, what was done in phase one. Every single bid that has been accepted for Changing Futures is different. So I spent this morning with the other 14 regions that have been awarded, and we're all doing things quite differently, but we're all learning from each other, which is fantastic. Right, so the very first thing then was to try and put into place a trauma-informed workforce to start the development of that workforce. So one of the first things that we did was to basically, with all the partners, establish whether we were on the right track to think about putting in place a clinical psychologist. And that role is to support all the third sector organisations that are behind the programme and their workers. And we're delighted that we managed to appoint a lady called Dr. Jo Jennison. She can't be here today because she's at the other event, but she has offered to come and explain what she's doing at another one of these meetings if you'd like her to. So Dr. Jennison is basically there supporting all the workers that are out on the streets to deliver a trauma-informed approach. We also made a very substantial investment from the fund into a trauma-informed care training programme. And I think there's now about 400 people on that training programme in Surrey. It's been developed as the years gone on, and a lot of people with lived experience have been involved in creating that. And then, of course, we've had to integrate everybody into a much wider training opportunities that are available. So things like mental health first aid, suicide awareness, etc., etc. There's a huge range of training that's available to people and funded through the project. And so the other huge thing for us was the development of experts by experience and peer mentoring networks for people with multiple disadvantage. Now, there were, of course, in Surrey, many different networks, but for people with mental health issues and or substance misuse issues, etc., but nothing for people with multiple disadvantage. And this has taken quite a substantial amount of time. So we now have 12 people that we work with day in and day out. One of the huge big issues in all of this was we set up a remuneration work stream, And in order to remunerate them, if that's what they want, whether it's vouchers or whatever, the process and the duty of care that we have to be very aware of and administer is much greater than I think many people had understood. So that's now taken us into work with the Department of Work and Pensions and all the local job centres, etc., to make sure that if people are receiving vouchers, that they're also going along with the correct paperwork, and that any contributions that we make to any beneficiaries are then recorded properly, so that their housing or any other benefits aren't affected by helping us on this programme. So that's been a huge bit of learning for everybody. Thanks, Karen. And oh yes, this was one of the very first things that people with multiple disadvantage did for us. So they created the very colourful logo, and they've explained there themselves why they came up with that logo. It took them about 3 months, and the 4 people that are in these photographs have all given their permission to be in the photographs, etc. And they created that themselves. So they were people that had, most of them had lived in the cabins over a period of time, and I'd offered this back to the programme as a thank you. Thanks, Karen. And so we have commissioned on a place-based initiative an alliance of 10 local VCS providers to deliver for us a trauma-informed assertive outreach service. It's a mouthful, but you get used to it. So we called it Bridge the Gap because that's what people in the communities wanted it to be called. So people with lived experience felt there was a huge gap from the streets into services, and so did many, many, many of the third sector and faith groups. So they collectively called it Bridge the Gap. And behind all of that is all that infrastructure that we're putting into place to make sure that all the outreach is trauma-informed. So I've just highlighted there who our 10 providers are. The Surrey Domestic Abuse Partnership has 4 domestic abuse charities inside it, so that's why it's shown as 1. And we're working very hard with them. So the offer that is on the table, and it's completely co-produced, the offer was that the hours of the outreach will go up till 8 o'clock at night, because you've got all your housing departments who we work with very closely. They've got all their outreach teams, you get social services outreach teams, etc., etc. But we felt that for this cohort, well, I didn't feel it, but they all felt that it was better going through to about 8 o'clock in the evenings, and then also at the weekends. And it's a very long-term, open-ended relational support. It's county-wide, so it's covering the whole of the 11 districts and boroughs. And as it develops and it beds down, then we're getting to know all the other kind of outreach services that are out there and bringing them in where we can into the trauma-informed approach. Thanks, Karen. Okay, so now the next thing, well, one of the huge big parts of induction for all of the trauma-informed team, the outreach workers, etc., is to integrate them into all the other systems that are going on in Surrey. So within Surrey, we now have 25 homeless or GPs who are offering the homelessness agreement services, which is fabulous. And we developing that as time goes on. We aim to get 35 by Christmas. I think there's 68 GPs offering the integrated mental health services. And then there's a personalisation agenda on social prescription, etc., etc. In partnership with the housing departments, Public Health has put in capital money to co-purchase 10 Housing First units. And for those of you that know about the Housing First programme, it really is for the most complex people. And so into it, and the providers that have been awarded those contracts from Home England, I think they're allowed up to 4 hours a week of support for the individual. So we will now supplement that with the Bridge the Gap trauma-informed outreach where people need it. I'll not go through all the other things, but it's things like getting inductions into the cooking service, the high impact complex drinkers, make sure everybody knows what the community champions are doing, etc., etc. And just trying to integrate everybody together. Thanks, Karen. So that was phase 1. and we're going on to phase 2. So another thing that came out from all the consultation and discussions that we had with people and all the dialogue that went on before we put in the Changing Futures bid was about the fact that there are many people, as the whole audience I'm sure know, have mental health or behavioural difficulties or issues and use substances. And there was no system, there is no system really to get them into the right place at the right time within the current systems in Surrey. So one of the big ticket items that we had put through was the co-development of a co-occurring condition service. And that's the next phase that we move to. So we'll have a mental health focus, and I'll get to that in a minute or two in another slide. But it's a mental health focus and linked obviously into substance misuse services, etc. But it will be run in partnership with the GP practices and a place-based commissioning approach. And then for us, huge big next bit is where we're going to get the money from after March 2024. Easier said than done, but I'll pass through that in a minute or two. Karen, how am I doing for time? About 4 minutes or so left for the slide deck, I think.
You've got a couple more left, and then
Okay.
you want to leave yourself some time for questions.
Yeah, questions, that's fine. Thanks, Karen. So co-occurring conditions, phase 2, our work stream 1 is setting up a co-occurring condition service. So the focus on mental health, behavioural issues, substance use. I mean, obviously, when communities find people in the streets, they don't know if they've got mental health problems or behavioural problems or whatever. They just know that people need help, and that's what we're trying to achieve. So the Changing Futures concept proposal was that it would be a psychologically led service. The discussions that we've had around the entire system is perhaps to get another clinical psychologist to support Joe. I forgot to mention Joe's actually got 2 students, but I'll get back to that later. But to get somebody else to work alongside Joe to offer a clinically led street side service. And well, a psychologically led street side service. And then we would wrap that with a mental health social worker and a very senior, probably a grade 8A prescribing nurse. That's the kind of discussions that we're having with many, many different people within Surrey and beyond, well beyond Surrey, you know, what's happening elsewhere in the country. And that's certainly where being a member of Changing Futures has certainly helped us. We've got lots and lots and lots of input from throughout the country, which is great. Then the next part of phase 2 is all about the evaluation. So I'll just zap through this very quickly. The evaluation has got 3 main objectives. So this is the Changing Futures evaluation plan. 3 main objectives is to provide the evidence on whether and how Changing Futures has made a difference to public services, to individuals, and to assess whether it's offering value for money. Now, part of our proposal was that it may not just be data and lots of it, because that's the normal way that people will look at whether there is evidence or not. But there's an awful lot to be said about people telling their stories and podcasts and videos and from people with lived experience, rather than it just being pure and utter data. So we had, in our original proposal, we had said we wanted to focus on a more sort of relationship kind of evaluation, notwithstanding that, of course, we will need to have a substantial amount of data behind us. So the national evaluation teams that have been assigned to Surrey. Karen, could you go back that one slide? Thanks. So it's these 6 that are on the slide. They're all working with us in different ways to help us with the evaluation of what's happening against those 3 objectives. Then within Surrey, we are also doing our own evaluation. So through COVID, we piloted what effectively has become Bridge the Gap trauma-informed outreach service. We piloted that ourselves. And so we're having that entire pilot evaluated by CTEC under our local evaluation. Behind all this, it's really interesting to just mention this, but we use a product called eSINs, and it's a data and case management system. It's used extensively in London, and that's where I came across it first, but it is used under licence by the police in Surrey, and there's 4,300 or so cases live on it. So all of our third sector organisations use eSINs for us. So everything goes into the eSINs data and case management system. And then so the story's told once, and anybody that's registered into that system, whether it's police, probation, adult social care, children's social care, all our third sector organisations, all the housing departments, they can all read what's in eSINs, obviously with the correct consents having been signed off. So the baseline data that I showed you earlier, we use this so regularly. I mean, we use it practically every week, really, with people with lived experience in third sector organisations, just to see how we're moving forward. There's a link down there at the bottom. It's completely live. It's interactive. If you'd like the password, I can give it to Karen. She could send it out to you. But this is what we're using to see our own progress. Like, are we moving away some of the blockages? Thanks, Karen. So we've also put in place with the third sector and people with lived experience who chair this board. So we've put in place an outcome delivery board. So we have brought in a consultant, a completely independent consultant, to gel together all the third sector organisations. He works for us for 2 days a week with people with lived experience, and they are setting up their own outcomes delivery board. So what do outcomes mean for the individuals that are receiving the services? So joint sustainability planning, I'm getting to the end, everybody, honestly. So joint sustainability planning, I'm usually running these slides with Vicky Stobart. Vicky is the Director of Long-Term Planning and Delivery for Surrey Heartlands. So she's one of the 2 ICSs. And we work very closely with Frimley also. In fact, the cabins were in one of the biggest cabin sites were in Frimley. But Vicky and I are doing this joint sustainability planning circuit for now. And we're going around those 27 partners who had originally signed for the Changing Futures proposal and potential new partners who might want to invest in this going forward. So depending on which figures you use, the cost of a person with multiple disadvantage per annum is about 28,800. These figures were extracted from Fulfilling Lives. These are the outcomes that people with lived experience of the Fulfilling Lives programme said that they wanted to achieve. And we have our own for Surrey, and we're just finishing that off now. I will insert that into the slides. But things that came out of Fulfilling Lives were a massive reduction in A&E attendances and nights in custody and reduced criminal justice, etc. Hospital admissions went down. And depression and anxiety for the person. So then we've just extrapolated those figures out with our partners to try and establish how much it's costing each of our partners to fund a person with multiple disadvantage. This is by no means perfect. This is just our first tranche at it. And we know that we've got a lot of work to do, to continue to do with it. But if you use the figure of 28,500 for one person, in June 2021, Surrey had 40 people registered with multiple disadvantage. Now with Changing Futures programme, we're aiming for 300. The cost to the system for that person would be 864,000 per annum. And if we then put in all the sort of softer societal costs, it comes out to about 1.2 million or so per annum that we're trying to avoid in terms of costings. And that's what we're asking for. So we're going around to ask all the different boards and internally, externally funding arrangements if we could have the same funding for 300 beneficiaries. There's probably thousands more. If you ask social services, they can come up. Children and adult social care can come up with many, many more. But for now, we're anchoring it at 300 because I think we're getting there. So we took a paper to the joint Health and Wellbeing Prevention and Wider Determinants of Health Board, and we asked the commissioners what evidence they wanted to invest in the programme from April 2024, and they're feeding back to us what forward plans we needed to influence and what forums we needed to request investment from. And then really a request to you, to everybody here, is that if there are funds that you think might be appropriate for us to apply for, if you could write to either Vicky or myself, that would be very useful, and we can have a look at what's coming through. And that's it, really. Oh, yes, a sincere thank you. And the other little thing I didn't mention, because so throughout all of this, in the cabins and elsewhere, we're using bits of assistive technology. So for some of the beneficiaries who really would have loved to have a dog or a cat, we've been using some therapeutic robotics, which have helped calm people down. This little one in the corner there is called Paro the Seal. I've got one around the corner here. And for people that really need to de-stress, it sometimes works, it doesn't always work, but we've had a few heroin addicts that we've given a Paro Seal to, and they've been stroking and stroking and stroking for hours, and it's certainly calmed them down quite a lot. So we're using lots of different things behind the scenes to try and move things forward under the programme. Good, that's it for me.
Thank you so much, Collette. It's just amazing. And I think from a public health point of view, the three magic ingredients there, you're trauma-informed, it's relationship-based practice, and you're evaluating as you go. So if ever there was a gold standard example, this is it. And aside from that, your client group and the work you're doing is exemplary. Thank you so much for sharing. Any questions or comments or celebrations from the group? There's certainly a lot of best practice there. I'm sure that we can all adopt and employ. Susan.
Hi, I'm a nurse consultant in infection prevention in Brighton and Hove for the homeless setting. Just one quick question. In your seal, where you're saying you used it, which I can completely understand where you're coming from, for anxiety, for IV drug users, etc. How do you decontaminate it between use so that you don't increase the risk of septicemia to the individuals?
Yeah, we didn't transfer from one to the other. So I already had 4 of these from a previous assignment that I had, and we used the ones that I had, to be perfectly honest, and then just threw them in the bin when they weren't required any longer.
All right, so there's single person's use item.
Yeah.
Okay.
Oh yes, sorry, I should have made that clear.
Okay, fine, thank you.
Thanks, Suzanne. Nick.
Thanks, Tracy. Thank you very much, Collette. Just to add, you made that really interesting point about the veterans who'd experienced trauma and the relationships that they built with your cohort in the cabins. That's actually been passed on to Operation Courage, and I'm talking to Adele Stevens, who heads that up in my area in Reading, as something to pursue, because they thought it was a really interesting and somewhat unexpected development to come out of this. So that work continues. Thank you very much, Collette.
Oh no, it was great. That's wonderful. And when we reopen the cabin site, I'll be reusing that company again, and then Joe Jennison will be doing all the support and the reflective practice with the crew, because we did come across some very difficult situations through that period, and to have those guys there, that veterans themselves, most of them, they were just sensational. But I mean, if somebody said to me, I was going to bring a security guard into a homeless setting, they'd be going, no, don't think that's going to work. But actually, we did get them around 8 different homeless settings, and B&B where we needed it, and some of the hotels, because they were properly trained. I think that's the thing behind it.
Thank you. And Nick Maguire.
Thanks, Collette. So much good stuff in there. I don't know where to start. Pick up just in a couple of things. I think the trainees that you might be getting might be linked to a project that we're running, which is great. So I spoke to Joe about it, and we'll talk a bit about that in a second. That's fantastic to see that reach. Where do you start? The cabins, the mentals, the psychologically informed stuff. It's amazing. So a couple of specific points. Did you get a sense of how you had this notional population, or not notional, you had a population of 40 people. Do you get a sense of how much per person this innovation costs? Compared with 28,000, 29,000, you know, that it costs to keep somebody on the street.
Okay, so it's different figures from all over the country. I can get them to you. The figures I used in this presentation were Fulfilling Lives. Yeah, sure. In Surrey, I honestly, my own personal estimates, not validated, are it's near 43,000 for each person. Okay. Yeah, that's fair enough. Yeah, and then there is some nice figures I saw a few days ago, and they were coming out about 36,000. I mean, it's very variable because it depends on what support the person needs. Totally. So we costed up the mental health provision. We did an ideal mental health service, and it was about 16,000. That was just mental health, though. Yeah. You've got all of the other stuff going on as well, and of course, it should save a recurring 28,800, right, over years. So you've got that really nice. You know, there's an extrapolation to be done there, which is kind of interesting. And tension against that will be a proportion of people who will benefit. Some might not, but there's a kind of fairly complex and very useful set of calculations to be done, and you've got some great figures. It's amazing. I suppose the other thing is that we can't let people fall off a cliff edge at the end of this, and that's why we're starting our sustainability campaign now, because I want to make sure there's enough money there that, you know, people that need the support will get the support. Might not be directly through a budget that public health have, but that collectively the system will maintain things for them. Fantastic. Just one, my ears pricked up when you were talking about wrestling with remuneration for peers, because we're trying to do exactly the same thing, and it's tough. And the latest thing we're going into, of course, is IR35 tax rules, which suggest that, you know, you can't earn a regular income without being called employees. So I wonder if you thought about moving to an employee model, or whether you're going to continue with that particular way of thinking about things. Yeah, we're actually quite far ahead of that game now. Right. Let us share. I mean, certainly very happy to share it. This whole program is a learning program, so very, very happy to share with you where we are. And I actually met this morning at the Changing Futures program. We had Revolving Doors, who are the main peer mentor for the Changing Futures program, and we agreed with them how we were going to be dealing with the Department of Work and Pensions. So let us share that with you. I mean, anyone that's interested, just let us know, and as soon as we complete our learning and get it operational, we'll just share it with everybody. That's what it's meant to be about. Thanks so much. Brilliant. Cheers, Claire.
Thank you. Thank you. And the final question to you, Amy.
Yeah, hi. Really interesting, great work. First of all, I just wondered, how did you decide where the locations were going to be for the cabins, and kind of where were they? Were they, you know, like disused car parks, or, you know, how did you sort of decide?
Well, it wasn't too difficult in a way. It was whatever anybody gave us. Because can you imagine in Surrey to try and get a homeless cabin site? It had to be done very diplomatically. So one of them was in a leisure centre in Reigate, and it wasn't being used at that time. So it was a leisure centre car park. Of course, it was closed because of COVID. So we managed to get that with the housing department. The second one was actually in a school playground. That caused a bit of problem with the neighbours, but in fairness, that it was actually in Elmbridge, and the comms and engagement team of Elmbridge Council and the Surrey County Council comms engagement team worked really closely together and did a massive campaign. And in the end, we had so when it started, we had a bit of neighbourhood hostility, shall we say, in a nice sort of way. But then we had 600 people that were offering support into the cabin site. Then the third big site was in Surrey Heath, and that was another disused school playground. And the one that we're probably going to be opening up in the next couple of months, well, the one we are definitely going to be opening on, just the location, I'm looking at a farm. So I have found, although I didn't know, that Surrey actually owns quite a lot of farmland. So I'm out looking at farms really, and taking people with lived experience with us to see what they think. But that's how we decided. It was where the land was, and then everything else I could just cartridge in the waste, cartridge in like the water tanks and things like that. I just got the facilities management team to help me. Yeah, and you'll find that lots and lots of organisations just chip in. Like, we won't charge for half of the cabins, and with philanthropic donations for all sorts of things that I didn't even know how to accept the money. We were getting so much money thrown at us at one stage, but yeah, so very variable. But everything really depended on keeping everybody in the neighbourhood safe and engaging with all the communities. I think that's what helped us pull it all off.
Thanks so much,
Thank you.
Claire. A real example of grabbing every opportunity. Thank you so much. A really good session and great